Life after lung transplant. Congratulations on your recent lung transplant. With over 40 years in transplant experience, we are happy that you chose UPMC for your lung transplant care. The purpose of this video is to prepare you for your upcoming hospital discharge. Please refer to this video at any time. You may also share this video with members of your support team so they can better assist you with life after transplant. Contacting your lung transplant care team. Transitioning out of inpatient care can be stressful for patients and care partners. It is important to maintain active communication with your transplant team. Once discharged, you can contact your transplant team by calling the UPMC Lung Transplant Office. The office is open Monday through Friday from 8 a.m. until 4:30 p.m. and can be reached at 412-648-6202. For questions and concerns, please call the office during regular business hours. If you have an urgent need and your call is received after business hours, you will be connected to the answering service who will contact the transplant coordinator on call. You can also use the patient portal My UPMC to communicate with your transplant team. If you are experiencing a medical emergency, please call 911 or proceed to the nearest emergency department. If you are seen in an emergency department, please give your transplant doctor's name to the staff who is caring for you. If the emergency department doctor thinks that your emergency is directly related to your transplant, you may be transferred to UPMC Presbyterian. Potential complications after lung transplant. Complications are common after a transplant surgery. It's important that you are aware of some common complications that may arise. This list includes, but is not limited to, infection, cough that will not go away and produces mucus, shortness of breath, cold or flu-like symptoms, wound infection, fever, temperature of 100 degrees Fahrenheit or higher, changes in blood pressure, burning with urination. If you experience any of these complications, call your transplant coordinator. Signs of organ rejection. During the first 12 months after transplant, you are at the highest risk for organ rejection and infection. Your body's immune system sees your transplanted organ as a foreign object and tries to reject it. To help prevent this, you will take a combination of medicines to keep your immune system from rejecting your new organ. The most common signs of rejection include unusual tiredness or fatigue, shortness of breath, less ability to do activities, decrease in microspirometer readings, cough with sputum, temperature over 100 degrees Fahrenheit. If you are concerned about a potential sign of rejection, please contact your transplant coordinator. Preventing organ rejection and infection. It's important to take steps to prevent rejection and infection following your transplant, which include taking your medicines at the same time every day. It's important not to miss doses. Having your blood work drawn as directed. Do not take your medicines until after your blood is drawn. Do your spirometry as directed. Do not miss scheduled tests and follow-up appointments. Report early signs and symptoms of rejection. You may still have periods of rejection even when following these instructions. If you are concerned about a potential complication, please contact your transplant coordinator. For a comprehensive list of ways to prevent infection, please refer to your post-transplant booklet. Proper wound healing after transplant. Staples and sutures will stay in place for approximately 4 to 6 weeks following transplant. Please consider the following surgical guidelines to ensure proper wound healing. Check your incision daily. Don't take baths or cover your incision in water until it is fully healed. You are permitted to shower when cleared by the transplant team. Clean your incision daily with soap and water. Rinse well and pat dry. Never apply any type of cream or lotion to the healing incision. Wear loose clothing to avoid rubbing the incision during the healing process. Call your transplant coordinator right away if your incision shows any signs of infection, including redness, tenderness, swelling, drainage, bleeding, or odor. Returning to regular activities after transplant. Following your transplant, it will take time to return to your regular activities. You will need to avoid driving for a period of time after surgery. Your doctor will let you know when it's safe to drive again. You must be off all pain medication before driving. Please be sure to have another adult with you the first time you drive after transplant. Limit the weight that you lift, push, or pull to 5 pounds or less for 3 to 4 months. You can think of this as the weight of a 2-liter bottle of soda. The transplant team will tell you when it's safe to lift anything heavier. Rehabilitation and exercise after transplant. After your transplant, you may be feeling better than you have in a long time. You may find that you have more energy and are eager to get back to an active lifestyle. Walking is a great form of exercise that can be started soon after transplant. Your transplant team will let you know when you are able to start an exercise routine. When medically cleared, your transplant team will discuss pulmonary rehabilitation. Pulmonary rehabilitation is a specialized exercise and education program to help patients improve their quality of life. Nutrition after lung transplant. Prior to hospital discharge, your transplant nutritionist will review the importance of food safety, meal preparation guidelines, foods to avoid, any additional dietary restrictions if needed. It is important to follow these guidelines to avoid risk of infection. After transplant, it is important to follow the nutritional recommendations of your pulmonologist. Once your pulmonologist determines that you are safe to resume eating, it is important to focus on consuming a healthy diet. It is recommended to start with several small meals per day. Stop eating before you feel full. Eat slowly. Drink plenty of water unless told otherwise by your transplant team. Keep healthy snacks on hand. Plan your meals ahead of time. Please refer to your post-transplant booklet for additional information. Medications. After transplant, you will take a combination of medicines to help prevent organ rejection. Your transplant pharmacist will discuss your new medications in detail before you're discharged from the hospital. It's important to follow your transplant team's directions. Please do not stop or change medications without being instructed to do so by your transplant team. Never take any new medicines, including over-the-counter medicines and herbal supplements, without telling your transplant coordinator. Take your medicine at the same time every day. If you forget to take a medicine, contact your transplant coordinator immediately. Maintaining your health and wellness after lung transplant. Maintaining your health and wellness is a shared responsibility between you, the transplant team, and your local health providers. As a transplant recipient, it is extremely important that you work closely with your providers to ensure you are up to date on all vaccines, cancer screenings, routine eye and dental exams, and all other age-appropriate health maintenance testing. For a comprehensive overview of our recommendations to ensure a healthy lifestyle, please refer to your post-transplant booklet. Routine testing and follow-up care after transplant. After transplant, the transplant team will follow you for your lifetime. Prior to discharge from the hospital, you will be provided with an itinerary of your upcoming appointments. This will include follow-up visits, including pulmonary function tests, chest x-rays, and blood work, and biopsies. Please bring your medicines and your medication list with you to your appointments. You will need to have blood work done weekly once you are home from the hospital. Blood should be drawn 11 to 12 hours after taking your evening dose of anti-rejection medicine and before your morning dose of medicine. We recommend that you have your blood drawn on a Monday or Tuesday to receive results before the weekend. Please refer to your post-transplant booklet for a more detailed list of expected follow-up care and diagnostic testing. Thank you for choosing UPMC. After reviewing this video, we hope that you and your support team feel more confident in discharging home after transplant. We look forward to sharing this journey with you and are here to support you every step of the way. Thank you for choosing UPMC for your transplant care. For more information, visit upmc.com/lung transplant.